This boy in my class was such a good kid, but he kept interrupting and talking to the person next to him. It was so disruptive. I had to talk to his parents.
We knew my daughter was smart, but her grades never reflected it. Her teacher said he was frustrated too.
My son is into sports and video games and can play for hours. I don't think he's ever finished a book for class. He just doesn't stick with it.
We always had a great relationship with our daughter, so it shocked us when she wouldn't listen to us. It didn't seem defiant, so we couldn't understand why she stopped paying attention to rules, chores, and time.
These are the voices of parents and other adults who support young people experiencing symptoms of attention deficit hyperactivity disorder, known as ADHD. ADHD is a common mental health condition that begins during a person's youth. It impacts both the child and the family. If a young person displays symptoms of ADHD, family members and other adults in the child's life can support him or her by remembering a few important things. ADHD is a neurological condition. The disorder occurs when the part of the brain that helps a person focus doesn't operate efficiently. This is why specific stimulant medication can help. It boosts the productivity of the part of the brain that causes some problems. It's important to remember that ADHD is not due to bad parenting, and there is no evidence that it is related to gluten, sugar, or immunizations, other kids, or the weather. There is no fault or blame for ADHD. ADHD can affect academic performance. When a child struggles to focus attention, he or she might have difficulty with class performance and homework, including reading, writing, engaging in long discussions, or turning in work on time. This can result in grades that are not reflective of the child's knowledge, interest level, or overall academic ability. ADHD can affect behavior. Attention impacts how we behave and what we do. Young people with ADHD may have difficulty waiting their turns or sitting still. In a classroom, this can result in behavior problems, like blurting out answers before being called on, or struggling to stay in their seats. Untreated ADHD is often a reason that problem behavior can become a pattern. ADHD affects how a person feels. If children want to do well but struggle with grades and frequently find themselves in trouble, they can start to feel bad about themselves. It's frequent to hear a child say things like, "I don't know why I can't do this," or "I didn't mean to skip my turn," when ADHD starts to become a problem. These statements can easily become, "I'm no good at this," or "something is wrong with me." When youth think and feel this way, they become vulnerable to developing symptoms of depression or anxiety. Family support is necessary. Parents and other family members can help a young person understand that he or she does not have to feel blame for experiencing symptoms of the condition. Adults can help children with accommodations, learning new skills, and managing distress as they learn about ADHD and how it affects them. Treatments are available. ADHD can be effectively treated by specific medications, behavioral therapy, focused family therapy, skills coaching, and appropriate accommodations. Each of these is focused directly on how to manage the condition, practice specific skills, and improve a person's ability to focus on a task at hand. ADHD is not an easy condition for young people, and a child's family can be a significant part of the solution. By understanding the symptoms and effective treatments, a family can offer ongoing support, practical solutions, and effective help. And with help comes hope.